myths are really come more from the public than from people who have actually had the operations. I think that there's a general perception about bariatric surgery that these operations are a shortcut or an easy way out, that you walk in, you have the operation, you go home 2 hours later, and magically the weight comes off. At the end of the day, these are very effective tools, but it does boil down to eating right, taking vitamins, maintaining follow-up, exercise, and consistency with all of those things. And so, one of the things that I tell my patients is that, if they're feeling generous, I'll take half the credit for what they accomplished, but the other half is because of the choices and decisions and efforts that they have to put in day and day out every day for the rest of their lives. And so I think that that's the number one fallacy. I think another myth that seems to be very persistent is the notion that bariatric surgery is extremely risky. In fact, if you look at media reports and newspaper stories from 4 or 5 years ago, you probably couldn't even find the words gastric bypass without the word risky or dangerous immediately preceding the words gastric bypass. But one of the things that we have learned is that when bariatric surgery is performed at centers of excellence, and these centers are given this designation based on the systems that they have in place, the infrastructure that they have in place at the hospital and so forth, the training of the surgeons, the availability of a multidisciplinary team, and a significant volume of surgeries that are being done. The safety of bariatric surgery at centers of excellence is very, very good. And in fact, the safety profile at this point in time in a recent publication in the New England Journal of Medicine would suggest that the risk of dying after bariatric surgery is the same as the risk of dying after a gallbladder operation. It's not zero, but it's very, very low.
And so what makes the University of Chicago a strong destination for these procedures?
Well, I think that there's several key things to consider. First of all, we offer all of the different surgical options for the treatment of severe obesity, and what we try to do is individualize for each patient what we feel would be the best operation for them based on the severity of their obesity, the nature of the medical problems that they have, as well as taking into account, of course, what their own preferences are. Secondly, we have a very well experienced and a broad multidisciplinary team. We have nurses, dietitians, psychologists, nutritionists that are working with us literally at our sides, both on the preoperative side of care as well as on the postoperative side. And so I think that having us all together in one location, instead of having to have patients go from point A to point B to point C constantly, I think that that is a particular strength of our program, and it also speaks to the team approach that we take to the management and care of our patients. We have a long history of doing bariatric surgery at the University of Chicago. We have the longest standing program in a medical center of this size in the Chicago area, certainly. And we offer all the different operations from a minimally invasive approach as well, which is, I think, a very important consideration because the recovery is faster, the chance of wound infections and hernias is much less with the laparoscopic approach. Also, at the University of Chicago, we have the expertise of individuals in a whole range of disciplines: critical care experts, endocrinologists, gastroenterologists, radiologists, interventional radiologists, cardiologists, people who are world-renowned experts in all of these areas. And so if the need for consultation with any of these experts comes into play, we can feel very comfortable and confident in the individuals that we are consulting to assess with the care with our patients.